Topic of the video is femoral artery. We'll see origin, extent, course, branches and clinical correlation. Femoral artery is continuation of external iliac artery. It extends from mid-inguinal point to adductor hiatus. It enters the thigh by passing behind the inguinal ligament. It passes through femoral triangle and adductor canal. It ends at adductor hiatus and continues as popliteal artery. Branches in the femoral triangle are three superficial branches: superficial epigastric artery, superficial external pudendal artery, superficial circumflex iliac artery. Three deep branches: profunda femoris artery, deep external pudendal artery, muscular branches. Branches in adductor canal are muscular branches and descending genicular artery. Clinical correlation: femoral artery can be compressed against femoral head at the mid-inguinal point to control the bleeding in distal part of limb. Pulsations of femoral artery are felt in femoral triangle just below mid-inguinal point. As femoral artery is superficial in femoral triangle, it is preferred for cannulation, coronary angiography and angioplasty.